Good afternoon, everyone. This is Dr. Manjula. Today's lecture is on Caries diagnostic aids. So, we will be seeing Caries diagnostic aids under the head introduction, definitions of caries, and various classifications for caries, diagnosis, basic and recent advances in caries diagnostic aids, then conclusion with the references. So to begin with the introduction, we will see what does this dental caries mean. So dental caries and periodontal diseases are probably the most common chronic diseases of the world. Dental caries word is derived from the Latin word, which means Latin word rot or rotten. It is very common in population throughout the world and is the key factor which is responsible for the dental pain and as well as tooth loss. It also presents with a wide range of clinical features affecting all the age groups and all the surfaces of the teeth. So let us see the definitions given by different authors. So according to Sturtevant, dental caries is defined as an infectious disease of the teeth that results in localized destruction and dissolution of the calcified tissues. According to Schaefer, dental caries is defined as the microbial disease of the calcified tissues of the teeth characterized by the demineralization of the inorganic tissue and destruction of the organic substance of the tooth. Moving on to classification of dental caries depending on origin as given by Schaefer. They are incipient or initial or primary caries, recurrent or secondary caries, and residual caries. Incipient caries is the one, it is the first attack on the tooth surface, and recurrent secondary caries is the one that develops at the interface of the restoration and cavo surface of the enamel. And residual caries is the type of caries which is deliberately left behind during restorative procedures with the purpose of remineralization. Classification according to their activity, they can be classified as active lesions which are considered to be progressive, and inactive lesions which are called as chronic lesions. They are formed years previously and stop further progression. Depending on rapidity of progress, we can classify caries as acute or rampant caries, chronic caries, and arrested caries. As we all know, acute and rampant caries is a multiple active carious lesion occurring in the same patient. Chronic caries is it presents as variable depth, long-standing caries. Arrested caries, these are the one which are static or stationary, that does not show any tendency for further progression. That is called as arrested caries. Then coming to classification of caries depending on location, pit and fissure caries, the caries which occur on the pit and fissures, smooth surface caries, and root surface caries. Then the very important classification that comes as G.V. Black's classification, which means they have G.V. Black has given classification up to class 6. So the class 1 states it begins in structural defects of the teeth, that is pits, fissures, and grooves. So basically it involves the occlusal surfaces of premolars and molars, occlusal 2/3 of the buccal and lingual surfaces of molars and premolars, then lingual surfaces of maxillary anterior teeth. Coming to class 2 classification, these involve proximal surface of the posterior teeth. Then class 3 classification, proximal surfaces of anterior teeth. And class 4, proximal surface. Class 3 is proximal surface of anterior teeth without involving the incisal edge, whereas class 4, proximal surfaces of the anterior teeth with involvement of incisal angle or edge. Coming to class 5, GV Black classification of class 5 is nothing but cervical area caries occurring in cervical area of anterior and all the posterior teeth, and class 6 is occlusal cusps of posterior teeth and incisal edge of anterior teeth. The caries occurring on the occlusal cusp of posterior teeth and incisal edge of anterior teeth. Moving on to diagnosis part. Diagnosis is very essential for the successful treatment. So it should be systematic and well organized for the specific purpose. The word diagnosis is derived. The word dia means in Greek thoroughly, whereas dignoska means to know. So altogether the diagnosis is to know the condition thoroughly is called as diagnosis. So it is, we can define it as, it is a determination and judgment of variation from normal, or it is the art or act of identifying a disease. So why is diagnosis important? Why we need to know diagnosis? For the successful treatment, it forms the basis for a treatment decision, and also the diagnosis is important to advise and inform the patient, and you have to inform the patient about the condition with which they have come to us, or they have come to the dentist. Then accordingly we'll have to plan and explain to the patient about the condition and the treatment plan. So basically diagnosis, it will help in determining the disease and also for risk assessment. Coming to the objectives of diagnosis, to identify the lesion which do not require the restorations or either require the restorations, and the risk of the patient. Moving on to the diagnostic aids in caries, we have conventional as well as advanced, that is recent diagnostic aids. So let us list the conventional and advanced caries diagnostic aids. So in conventional caries diagnostic aids, we have visual and tactile examination with the help of mouth mirror, probe, tooth separation. Then radiographic method with the help of IOPA, bite wing. Then comes zero radiography, and lastly dyes. So these four aids are covered under the conventional diagnostic aids in caries. And coming to the advanced caries diagnostic aids, we have dental digital radiography, subtraction radiography, digital image enhancement, computed tomography, color coded radiography, MRI, fiber optic trans illumination, digital fiber optic trans illumination, quantitative light induced fluorescence, laser fluorescence, electrical conductance measurement, ultrasonic imaging, endoscope and videoscope. So let us begin with the conventional diagnostic aids in caries. Firstly, visual and tactile examination, which is the conventional method for detection of caries. This visual examination can be done by using compressed air so that the visibility of the tooth will be clear. And tactile examination has to be done with mirror and probe. When you are using the probe, it has to be blunt periodontal probe. So one has to observe carefully when it comes to visualization. So the patient tooth, you will have to observe the tooth for changes in color and translucency of the tooth, and also we should check for white spot lesion which appears chalky white in color, and there should be break in the enamel surface, and for any grayish white discoloration which is adjacent to marginal ridge, and shadowing on proximal surface, and black discoloration. So all these things have to be checked or inspected on the tooth when it comes to visualization of the tooth for caries. So as given in the picture, this is one of the visual method with elective tooth separation with the rubber bands. Coming to radiography, it is considered as one of the gold standard to detect the dental caries. Primarily for the detection of lesions on proximal surfaces of teeth which are usually clinically not visible, one will always go for radiography. So basically the principle here involved is radiographic diagnosis of caries will be made when the mineral content of enamel and dentin decreases. Hence, there will be decrease in the attenuation of the X-ray beam as it passes through the teeth. Hence, the area or the demineralized area appears radiolucent on the radiograph. That's how one can locate or identify the caries in the radiographs. Then coming to conventional radiography, that is nothing but we have IOPA and bite wing X-rays. Bite wing radiographs, they are used in detecting proximal caries, and any particular proximal caries is there which is not seen in the IOPA, we can always advise bite wing. And it is important to detect incipient lesions at the contact points of the teeth, and especially in cervical margins of restorations, and to check the alveolar crest height, and also to check for the lamina dura, and of course the size of pulse chambers will be seen very clearly in case of bite wing radiography. Then comes zero radiography. This technique works with the same principle as your Xerox machine, principle of Xerox machine. So it is a technique in which aluminum plate is coated with selenium particles. It has got uniform electrostatic charge and which is stored in conditioner, and whenever the X-rays are passed onto the film, it causes selective discharge of particles. So this forms the latent images and is converted to a positive image. Coming to the advantage of zero radiography, edge enhancement is possible, and disadvantages: electric charge over film cause discomfort to the patient since it is in humid environment which acts as medium for flow of current. And all this process of development has to be completed within 15 minutes. That is also one of the disadvantage of zero. And coming to the dyes, dyes are used for caries detection. So there are certain dyes for detecting enamel caries and as well as dentin caries. So the dyes which are used to detect the caries dentin is 0.5% basic fustian in propylene glycol and methylene blue. So the dyes for detecting enamel caries, they are Procyon, Calcine and Ziglo ZL22. So coming to the recent advances in caries diagnostic aids, RVG system. So this RVG stands for radiovisiography. This system was introduced by Dr. Francis Moine in the year 1989. So this consists of four main components, which includes X-ray set with special timer, intraoral sensor, and display processing unit plus printer. Advantages of RVG are all the procedures can be visualized immediately, and any area of the picture can be enlarged or can be zoomed, maximized to view in a zoomed clearly, and it provides necessary, as I mentioned, magnification is possible and good resolution is seen, and you can also change the contrast, and conventional developing is not required like your conventional radiographs. Coming to the disadvantages, small size of the sensor, which can accommodate only 1 molar tooth or 2 incisors at a time, and of course it's very expensive. The cost of the equipment is high. Coming to photostimulable phosphor plate. Here the image is captured on a phosphor plate, and then this is converted into a digital format when the plate is processed using the crystalline emulsion of barium fluorohalide compound.